I had a chance to have a 4-hour lecture for the residents of the Periodontal Department at the Columbia University in New York City on October 31st, 2014. This lecture's aim is to understand the new innovations, the surgical microscope that has taken place in Japan, introduces for the periodontal field. I have modified the lecture which I presented at Columbia University into 8 short presentations. Lesson 6. Number 2. Difficult treatment in the periodontal field. B. Root coverage in the lingual side. Case 1. Patient, 33 years old male. Due to the keratinized tissue recession, when brushing the right lower second molar tooth lingual gingival, it is very painful. I performed surgery using the microendoscopic technique Akiyama method. Post-surgery 9 years. Good result, no pain. Case 2. Patient, 55 years old female. Referral case. Her right lower second premolar tooth lingual size gingival tissue is too thin. She complained that when she brushes tooth number 29, she feels pain in the gingival tissue. She hoped to solve this problem. I performed surgery using the microendoscopic technique Akiyama method. Post-surgery 1 day, post-surgery 1 month, post-surgery 1 year. This is a post-surgery 10 years 1 month. This prosthetic treatment was performed by another dentist. She gingival recession around the implant. Case 1. Patient, 44 years old female. Referral case. Periodontal regeneration surgery was performed by her previous dentist, but yet the pockets remain. These are the patient's X-ray. This is a previous dentist treatment. This is a previous dentist treatment. The dentist asked me to please treat this patient by use of your microsurgery. The patient desired to save her natural teeth and she desires to have a beautiful smile. This time, I focus on the implant treatment for aesthetic area. The front upper bones condition is very severe for aesthetic implant therapy. The front upper bones condition situation is very severe for aesthetic implant therapy. Before the implant placement surgery, I made a provisional bridge. This is the implant placement surgery. I performed GBO technique. Post-implant placement surgery. Post-implant placement surgery 30 days. After the implant placement, I waited 6 months. Post-implant placement surgery 3 weeks. Post-implant placement surgery 6 months. Post-implant placement surgery 6 months. Post-second surgery 4 months. After the second surgery, the soft and hard tissue around the implant recessed. Recovery surgery. Patch technique I already explained. This is a recovery surgery. At this time, I increase the thickness of the gingival tissue and raise the gingival tissue around the implants. Pre-recovery surgery, post-recovery surgery, post-recovery surgery 6 months. The gingival tissue around the implants will be thicker than the previous surgery. As we can see, I was able to significantly increase the amount of tissue around the implants. This is a post-recovery surgery 3 years 6 months. These are the zirconia abutments. In this clip, I'm checking the zirconia bridge frames fitting. This is a patient's bridge. This patient has a low lip line, therefore I created a shallow margin. As you can see, I use the surgical microscope for every treatment. I remove the cement using the microscopic technique Akiyama method. So this is a void for periodontitis. Treatment result. Pre-recovery surgery, post-recovery surgery. Pre-treatment, post-treatment. Pre-treatment, post-treatment. Pre-treatment, post-treatment. Pre-treatment, post-treatment. Pre-treatment, post-treatment. Provisional bridge. So, post-treatment. Pre-treatment, post-treatment. This patient has a low lip line, therefore I created a shallow margin. Post-recovery surgery 6 years. So this is a post-recovery surgery 8 years. Good result. Case 2. This patient's dentist is a very famous dentist in Japan. The patient is a dentist too. The patient had the implant placement at his dentist institute. After the second surgery, the gingival tissue and the implant recessed suddenly. We can see the implants platform through the gingival tissue. His dentist said that this recovery is very difficult, so the patient came to my office. The patient brought the pictures from his previous surgery to my office. He gave me these pictures, so I tried to find the cause of this trouble. The parietal bone was broken during the implant placement surgery. The patient took the pictures at live surgery. The second reason is the angle of the implant placement. This angle of the implant placement is too labial. This is a rare case because palate gingival tissue has got recession. So previous dentist just after second surgery, post second surgery 3 months. The cause of this trouble. We can see the gingival tissue height around the implant is about 1.5 mm. It is very hard to achieve an aesthetic result. I performed the surgery 2 times because the blood supply is very poor. The first surgery's purpose is to increase the blood supply. The gingival tissue will be raised around the implant at the second surgery. We can see the implant's platform through the gingival tissue. The second cause is the angle of the implant placement. This angle is too labial, so before surgery, I adjusted the provisional crown's labial side. The periodontal ligament incision is made using the microblade through the sulcus. This surgery's purpose is to increase the blood supply around the implant, so the incision has to be made very carefully because the gingival tissue around the implant is very thin. Tooth number 9's distal side and 11's mesial side will be treated using the patch technique. The connective tissue is harvested from the palate. The connective tissue is harvested from the palate. The connective tissue is inserted in the envelope gently because the gingival tissue around the implant is very thin. The connective tissue is sutured by the 7/0 thread. Tooth number 9's distal side and 11's mesial side will be treated using the patch technique. This is my technique. I pull the gingival tissue using connective tissue harvested from the palate. The suture is fixed with resin picks on the crown of the tooth. Pre-surgery, post-surgery. This is the second surgery. This time, the gingival tissue around the implant is raised to the corner side. Akiyama's microscopic shape is easier to put in the gingival sulcus, so Akiyama's microscopy makes the periodontal tissue abrade easier. Better TCP was placed in the palate and the labial side around the implant. The provisional crown was replaced. The connective tissue was harvested from the palate. This connective tissue was transplanted to the labial side around the implant, sutured using 7/0 thread. My original technique was named the patch technique. I pulled the gingival tissue coronary. I used connective tissue harvested from the palate inside the gingival tissue like Achikara nuno. This connective tissue reinforces the gingival tissue, raising the gingival tissue and fixing the suture using resin. Pre-surgery, post-surgery 7 months. Pre-surgery, as you can see, the gingival tissue height around the implant is about 1.5 mm. Post-surgery, as you can see, the labial gingival tissue height around the implant is over 5 mm. Pre-surgery, post-surgery 7 months. Very good result. Post-surgery 4 years 6 months. Very good. So almost 6 mm I can make. Post-surgery 4 years 6 months. In this case, the patient requested that I treated his implant's gingival recession. After successfully doing so, he then requested that I perform orthodontic treatment using the microscopic technique Akiyama method. I performed orthodontic treatment. Treatment result. Pre-treatment, post-treatment. Pre-treatment, post-treatment. Pre-treatment, post-treatment. Pre-treatment, post-treatment. Pre-treatment, post-treatment. Post-surgery 6 years. Still good situation, very good condition. Post-surgery 7 years. Case 3. Pre-surgery just surgery pre-surgery post-surgery 1 year post-surgery 1 year Case 4 Pre-surgery post-surgery 1 year International volunteer in Nepal. I visited Nepal 1 week. All treatments were done: periodontics, orthodontics, restorative, and endodontics therapy by Katsuhiko Akiyama using the surgical microscope technique named the microscopic technique Akiyama method. This innovation comes from Japan. Lesson 6. Thank you for your kind attention.